Welcome to Moments with MamasteFit. In this mini episode, we're going to be talking all about the placenta, which is one of our favorite organs, not to consume, but to sustain my baby as they grow in utero and also admire it after it's been born. And so we're going to talk about what is the placenta, how does it develop, and does your placenta age? Does it have a deadline that it just stops working? And should you be induced immediately because of that? We're going to discuss all the nuance of that in this mini episode. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I am a mom of 4, so I have had grown 4 placentas. So
Yeah.
I feel like I'm experienced in the placenta growing.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I've grown 3 placentas and 3 babies from those placentas.
And they're all healthy-looking placentas.
Yeah.
So let's talk about what is the placenta. If people are not familiar with that organ, Roxanne, can you share what does it do?
The placenta is the filtration system for your baby, how your baby is nourished with your body. All of the nutrients and oxygen is filtered through the placenta to the baby through the umbilical cord, and then all of the waste is pulled from baby, filtered through the placenta, and then filtered out through your body. But all of the transactions of all of these things happen within the placenta. And within the placenta, there are different filter units that are called cotyledons, and we have 20 to 30, depending on the person, of these little cotyledon systems, and all of the filtering and nourishing to and from baby is happening within each of these systems. But sometimes during pregnancy, these systems can go wrong, and then nothing is happening within those systems. But that's why we have so many of them to kind of take over for if one goes down. The placenta does a lot more than just nourish our baby, though. It's also a barrier for the outside world because it's also not letting everything through the placenta. So not everything that you consume or put into your body will cross that placental barrier. Some of the things are stopped and not allowed through, but some things are allowed through. So still being mindful of what we're consuming into our body, as well as different viruses and bacteria can't get through the placenta. So it is acting as a barrier and a protective mechanism for our babies as well. So the placenta, super cool. When does it develop though? So a lot of people are concerned during the first 4 weeks of pregnancy, you don't really know that you're pregnant. And they're concerned about everything that you're taking into your body and is it affecting your baby? Well, placenta is not fully embedded into your uterus yet. So the things that you're taking in, not at that moment, not necessarily affecting baby, but everything from the previous months are affecting the baby. So if you had 1 glass of wine at 4 weeks pregnant, that I also did, it's likely okay because your placenta hasn't fully embedded into that uterus until about starting at 4 weeks.
So baby is not receiving nutrients and stuff from you
From
yet.
your body directly just yet. At 4 weeks, this is when the implantation starts. At 8 weeks is when it kind of starts to reach its peak of building those little blood vessels to your blood vessels. Around 8 weeks is when that kind of starts building those navigational systems. And then 12 weeks is when it reaches its peak of those formations. But the placenta continues to grow. It's not just it's there at 12 weeks. This is the placenta that's going to be there until the end of the time. It continues to grow as baby grows to kind of accommodate those changes that the growing baby needs. When they're a little 12-week fetus, they don't need as much nutrients as when they are a 32-week because they're just larger. So your body is accommodating those changes. But
at 36 weeks, your placenta is I'm good. I'm as big as I need to be. And this is where we can start to see some of those signs of aging or maturation. And so your baby is still rapidly growing at 36 weeks, but your placenta, growth has plateaued, but it still maintains its functional capacity. So previous to this, the placenta's functional capacity was much higher than our baby's demands. And so this was giving you a little bit of a reserve for baby. So baby was able to kind of sustain itself a little bit longer because the placenta has a little bit more function and kind of capability, just kind of waiting. And this is going to continue to about 36 weeks. There's still going to be a little bit of a barrier or a gap of efforts but it's going to decrease as baby's fetal demands are increasing towards the end of pregnancy. And this can sometimes put a little bit more stress on the placenta. And so at 36 weeks, you may start to see some signs of aging or maturation, but these don't necessarily mean that there's a decrease in function. It's more of just a change in appearance of the placenta. And so some of the signs of maturation that you can see will be like calcification. So these little like white spots or like clumps within the placenta.
It feels almost like sand or grittiness within the placenta if you feel it.
So when you give birth, I would highly recommend taking a peek at your placenta, and you can sometimes see them or you can feel them when you touch the placenta. And these can be pretty normal if it's happening after 36 weeks. It doesn't necessarily mean that your placenta is not working as well. Now, if you're seeing this prior to 36 weeks, like you're like 30 weeks and you're seeing these signs of maturation, that could be an issue. Like we don't want that to start happening too soon. But if you're seeing it after 36 weeks, generally it's not an issue, and it's a good conversation to have with your provider if they've noticed it on like a 36-week ultrasound or 38-week ultrasound, and they're bringing it up as a concern to you, is to have a conversation on what does this really mean for us. Other things that can happen at 36 weeks is within the placenta, there's all these little like tiny little finger like microscopic things that help to increase surface area. And that surface area is what is kind of bringing in the oxygen, bringing in or taking out the metabolic waste. And it's where all the exchange is happening.
These are within the little cotyledon system.
Yeah. So they're essentially like all these like the reason why our brain is not smooth and has all these like ridges and curves to it is because it increases surface area. And so within your placenta, you have all of these little villus that increase surface area for all of this exchange to happen. At 36 weeks, some of that surface area starts to decrease as they kind of like at the end start kind of like clumping together just from the placenta's doing a lot of work at this point. Again, not normally a functional issue, just a normal part of its maturation. And the last thing that can start happening at 36 weeks as the placenta is beginning to mature is your amniotic fluid can actually decrease because the placenta can help to influence how much amniotic fluid you have.
And the reason why decreased amniotic fluid can be an issue, and this is called oligohydramnios if it's below a certain amount, is because the amniotic fluid is our cushion for our baby, particularly our umbilical cord. So if there is decreased fluid, there is decreased ability for your baby to move around. So potentially baby's just not able to move, which tells you that maybe baby is not, happy in there anymore. And then also it increases the risk of something called an umbilical cord injury. So that something happens to the cord because there's not as much cushion for those cords to protect it. And then if something happens to that umbilical cord, that is that baby's lifeline and something could then happen to baby.
So what are some tests that somebody can get towards the end of their pregnancy to help look at placenta function, to take a peek at maybe what's going on, to look at the fluid levels so that they can feel confident to either continue pregnancy or maybe consider a medical induction?
So there are different things that they can look at. People don't normally get like gradings of their placenta unless they have some sort of complication, but sometimes they can get gradings where they grade the placenta on 0 to 4 and they tell you how like functioning your placenta is. But those aren't normally recommended unless you have some high risk things that could be affecting the placenta like preeclampsia or diabetes and like it's like very uncontrolled. But what you can do is look at baby. And so this is with something called a biophysical profile. It's an ultrasound looking at how well baby is doing within the womb. So it's looking at your amniotic fluid volume, which we talked about is important, how the baby is moving and what type of movements they're doing. So are they doing gross movements, so like large movements, the finer movements, which is more like neurological development? Are they doing practice breathing movements? So all of these things are graded on a scale of 0 to 2. So you can only get 2. You can't get 1 for like doing part of it. It's either 0 or 2. And those numbers together will add up to 8 or less than 8. If it's 8 out of 8, baby is doing well. If it's 6 out of 8, this is when we would like determine like we could probably check in on baby again. We're not overly concerned, but we probably want to keep an eye on baby. If it's less than the 6, though, so it's 4, 2, or 0, this is when we would likely recommend an induction at this point because the baby is giving us signs that they are not doing well. Regardless of the numbers, though, so if you get a 6 out of 8, but the thing that you lost on was the amniotic fluid, so the amniotic fluid level was too low, we would still recommend an induction at that point, because amniotic fluid volume, we know, is very important for those babies. And if the amniotic fluid volume is low, it's very related to the placenta function, as well as how well baby is doing if that is low. So we would always, even if you got that 6 out of 8, like everything else looked great with baby, we would usually still recommend an induction because that amniotic fluid volume is really low.
And with induction, it's always a conversation. It's not, if you have this, you must get one right away.
It's a recommendation.
Having a conversation with your provider about your concerns with a medical induction versus continuing pregnancy is always going to be our recommendation when we're navigating these nuances of what is safe to do throughout pregnancy, what are medical recommendations, and then also what are your own preferences for your birth experience.
Another thing that they'll likely add on with the biophysical profile, if they're able to, is a non-stress test. So this is where they put you on the fetal monitor, where they're monitoring contractions and baby's heart rate for 20 to 40 minutes, depending on how baby is doing. And they're looking at the baseline heart rate of where baby's heart rate is, along with the variability. So the beat to beat changes, because all of our heart rates has that beat to beat changes called variability. And then is baby having any increases in heart rate, which is ideal, or are they having some decreases in heart rates? Based off of that, we would want what's called a reactive tracing, which means that baby is having pretty good beat to beat variability and having at least 2 increases from those baselines, depending on their age, 10 to 15 beats above that baseline. If they don't have that, that's called a non-reactive tracing, and that would also give you 0 points versus reactive gives you 2 points. So if you get a 10 out of 10, then on that test, then baby is doing real well. 8 out of 10 even would still be doing well. 6 and below still conversations of either recommending induction or continuing to monitor baby closely.
So with the placenta, just because it ages or changes appearance does not mean it just expires. It's not like once you hit your due date, the placenta doesn't work anymore. You must get induced right away. There is some concern, an increased concern for stillbirth if you go past 41 weeks or 42 weeks, because maybe the placenta is not going to continue to function well beyond that point. And so that's where doing these additional tests can be really helpful to helping you feel confident to either choose an induction or to continue with your pregnancy. And again, always a conversation to have with your provider. But there are some things that can impact your placenta's development in a negative way. There are certain health complications that may impact how your placenta is developing, or maybe the result of how your placenta developed. And there are also things that we can do to help improve our placenta development to help decrease the likelihood that it may mature or age too early.
So different things that could affect your placenta's function, either development or just long-term function, is if you are smoking during pregnancy could affect your placenta's function, especially depending on how much you are smoking. This can then lead to your babies being smaller because of that decreased placental function. Other things that can affect it are preeclampsia, so elevated blood pressures, or preeclampsia, so either or can affect the placenta's function, as well as diabetes, either pre-existing diabetes or diabetes that develops during pregnancy. And it really is affected based on how controlled the diabetes is. So if your blood sugars are well controlled, even if you have type 2, type 1, pre-existing, or if you develop it during pregnancy, if it's well controlled, likely the effect on the placenta is not going to be as much. But if it is very uncontrolled, this is going to have more of an effect on that placenta's function long term. Other things that can develop during pregnancy that are also kind of common is anemia, especially iron deficient anemia, low vitamin D and calcium, because those are all things that babies really need a lot of during their development. And this can develop during our pregnancies because we maybe are not taking in enough of the nutrients that we need. But all of these nutrients can affect the placenta's function, even if they are very common during pregnancy. And then the last thing is infection. These infections can come out of nowhere. Sometimes they are caused by different bacteria that are already kind of pre-existing within our body, but infections can affect how our placenta is functioning. A very common infection is GBS that can develop early on in pregnancy, that can affect the placenta's function and can sometimes lead to preterm birth as well. So knowing that there are tons of things that sometimes are within our control and sometimes out of our control during pregnancy that can affect our placenta.
All of these complications can essentially chronically stress the placenta, which can decrease the blood flow, which would then have a negative impact on our baby's development and also negatively impact the function of the placenta. And so in some of these situations, a medical induction may be the recommendation because continuing pregnancy is not optimal when the placenta is not functioning well. And so keeping an eye on different signs of maturation happening too soon can be beneficial. Doing the biophysical profile or the NSTs can be helpful to see how baby is doing, in addition to managing complications that you have throughout your pregnancy. And so things that we can incorporate in our prenatal routine to help to support our placenta's development and function is one, routine prenatal care. This is going to be the way that we're going to identify if there's complications during our pregnancy, and then working with our provider to monitor both our own health and our baby's health is going to be really beneficial. Other things that you can incorporate into your prenatal routine is going to be regular exercise, especially in the first half of pregnancy. There's research to support that exercising in the first half of your pregnancy when your placenta is developing initially is incredibly beneficial to the placenta's development. It helps to increase the placenta volume and functional capacity by exercising at a moderate intensity level within the first 20 weeks. And again, that's where like a lot of the key development with the placenta is happening, where it's implanting into the uterine wall, it's going through its remodeling phase, and all of this is happening within the first 20 weeks. And so exercising regularly can be incredibly beneficial for that. Obviously, we have prenatal fitness programs that can help support you with that so that you can start exercising and working out regularly from the very beginning. But doing any sort of exercise routine, going for daily walks, incorporating like aerobic activity for yourself are all really beneficial to supporting your placenta's development. And the last thing that we can incorporate is going to be our nutrition. So we want to make sure that we're eating nutriently dense foods. Obviously, eat the foods that serve your soul as well. Cookies and cake are still beneficial, but we want to be incorporating food that have folate in it, B12, zinc. These are all going to be really beneficial things to help to support your placenta's development as well.
So the placenta, my favorite organ that we grow ourselves.
Definitely look at it. Do like a tour of your placenta. That's like one of my favorite things other than the baby. After the baby has been born, to do like a little tour of your placenta, because you can see like the what do you call it? The dirty Durkins. I can't remember what it's called.
So there's two sides of the placenta. The side that the baby is living on, the fetal side, that's called shiny Schultz. I don't know who these named after. I learned it, but I instantly forgot. It's probably men. But the fetal side is called shiny Schultz because when you look at it, it's very shiny because it's where the amniotic sac is the lining it and all of the blood vessels. So it's like the tree of life that the baby's umbilical cord is the stump.
Aesthetically pleasing.
And the blood vessels are coming out. It's beautiful, super pretty. People make artwork from that side. And that's usually the side most of the time that comes out first. Because if you think about it, the umbilical cord is being tugged on and it's pulling that side of the placenta out. But sometimes the other side comes out first, which is the not pretty side. It's the maternal side, the side that was embedded into your uterus. So if you think about it, it looks like just shredded meat when it comes out.
It's like when you pull off a scab.
Yeah, that's what it looks like because that's literally what it is.
What's it called?
And it's called Dirty Duncan.
Okay, I was close.
Not what Gina said. Dirty Duncan.
I said Durkin.
The other side. And again, these are probably men. But Shiny Schultz, Dirty Duncan, those are the two sides, or fetal and maternal, whichever one resonates with you more. I like the other ones more. But those are the two sides of the placenta. So they'll show you both sides. And then I usually will pull up the amniotic sac so you can be like, this is where your baby was literally living. If you can piece, sometimes the amniotic sac is like in 4 million pieces. But if you can hold it up and then you just see
it
like
reminds
the
me of those like
sac,
sensory swings.
that baby. Yeah.
Where
literally, that's what it looks like. And then like the little
cocoon.
umbilical cord is just hanging out. And that's where your baby was living. And it's super cool. And you can feel it if you want to see if you had any calcifications. But then you can also see all of the little cotyledons when you look at it really closely, because we always make sure that all of those cotyledons are there, because sometimes they can, again, like come off and then just hang out in your uterus, which is not ideal. We don't want to leave any cotyledon units.
You can keep your placenta. You can do whatever you want.
You can eat it. You can make a smoothie out of it.
We planted ours
because it's has all of those nutrients in it, but it also is, remember, it is waste. It's not just nutrients, it's also waste from the baby in this placenta, but all of those things are really great fertilizers.
Yeah. So
for plants.
if you do want to keep your placenta, have a plan. Establish you'll need a cooler and some ice.
Yeah.
Or just
Because
somebody that
organ.
can take it for you.
It is an organ, so don't just leave it out. It will start to smell.
So the moral
degrade.
of this, I guess not moral, the conclusion of this episode is your placenta does not just suddenly turn off.
It's not like the lights.
You don't just flip a switch and it stops working once you hit 40 weeks. It does age. It does change in periods after the 36-week mark, but it doesn't mean that its function decreases. There are things that we can do to help monitor placenta function by looking at how baby is doing with those NSTs and biophysical profiles. If you're showing signs of maturation too early, this could potentially be a problem, and is typically more likely if you have other pre-existing conditions or complications such as high blood pressure, gestational diabetes. Maybe you're smoking throughout your pregnancy. If you have any sort of nutritional deficiencies, these can all be things that may impact your placenta's development. As with everything, having an in-depth conversation with your provider on any concerns that you have during your pregnancy, whether or not you should or should not be induced, is always going to be really important. So choosing a provider that you feel comfortable having these nuanced conversations with is going to be our top recommendation when navigating your pregnancy. If you want more support throughout your pregnancy, check out our online prenatal fitness programs and our online childbirth education course. Exercising throughout your pregnancy is incredibly beneficial not only for you, for your placenta's development, but also for your baby's development. And so we guide you from week 4 all the way to week 42 or however long you stay pregnant for. For me, I stayed pregnant towards that later end, except for this last one. But we guide you with daily workouts so that you can feel strong and pain-free as you feel more comfortable throughout your pregnancy and prepare for birth. Our childbirth education course is going to give you a lot more of the nuances of navigating this phase of life because there's no one best for everyone. Similar to this conversation, there's no one best thing even for our placentas or one test that you can do to determine whether or not it's good or bad. And so understanding the nuances of childbirth is going to be incredibly beneficial to navigating this phase of life with confidence and with empowerment. You can check out all of our online courses on our website at MamasteFit.com and use code MOMENTS10 to get 10% off any of our online offerings, and you can bundle them together to save an additional 15% off. New Moments of Mamaste episodes every other week. We alternate with birth stories, so if you're excited to listen to our listeners' birth stories, be sure to tune in then.